You're watching News 19 Daybreak with Dustin Lukey and meteorologist Alyssa Triplett. Daybreak continues right now.
Good morning and welcome back. Well, while we still await a COVID-19 vaccine, regulations like social distancing, encouraging hand washing, and face coverings will likely remain in place. But how do we know how effective those efforts are proving? Well, a psychology professor from Luther College in Decorah, Iowa, is part of a coalition seeking to answer that very question. Lauren Toussaint joins me this morning to talk a little bit about the Clean and Contain scale. Lauren, first, thanks for being with us.
Thank you. It's my privilege.
This Clean and Contain scale is something you helped develop in collaboration with, I believe, 3 other professors from universities around the country. Can you give us a brief overview of what it is and how it came about?
Yeah, early on in the pandemic, it became clear to myself and some of my colleagues that there was a lot of attention being paid to the biological aspects of the virus that was spreading. As important as that is, we recognized very quickly that our behavior in this moment is the only thing that we can control. There's no vaccine, there are no completely effective treatments, and so the very best thing we can do is act in appropriate ways to prevent the spread and the infection by COVID-19. And so that was kind of the genesis of the scale, is we wanted to be able to measure the compliance of people with these recommendations that are coming from, in this instance, we use the recommendations of the CDC.
And you do so on, it sounds like 9 different metrics, 1 to 5 scale on each. Can you kind of just touch on how each of the metrics works?
Yeah, it's really simple. We intended this to be a short scale, so it's not meant to be comprehensive and include every possible recommendation that's out there. Rather, it's intended to be a rather representative sample of the behaviors that you might engage in. The scale is very simple to respond to. It has a 1 to 5 response scale. The lower your score, the less compliant you are with the given health behaviors. It assesses things like cleaning behaviors, wiping down commonly touched surfaces. It assesses things like containing behaviors. That would involve something like trying to keep your germs to yourself. So washing your hands after you coughed or sneezed, or throwing away used tissues so that you don't spread the germs around the area.
How do businesses or organizations, health departments, how do they implement this sort of scale?
Yeah, I think you're starting to see some of these things pop up. The thing that we really wanted to do is, instead of requiring any sort of technology or anything that's necessary in that regard, this is very simple. It's available. I can distribute this to anyone that might be interested. It's also available on the web. So it's simply an instrument that can be printed and handed out. And when you get the results back, you can tally up the numbers and see where your organization might stand. And you might be surprised to find that in some cases, your workplace or your church or your social group is doing really good in one regard, and maybe they're not doing so good in another regard. And so the point of this is to make it accessible, and just about everybody has the ability to print a survey. It's also available in an electronic survey form if that's of use to people.
Yeah, and we'll have links to that on our website, wxw.com. Lauren Toussaint, one of the creators, developers of this Clean and Contain scale, thank you so much for joining me this morning.
Thank you.
Alyssa, over to you.
Well, thanks, Dustin. Here in the Forecast Center, we're tracking rainfall that's on the way for us, which is still much needed as we are in those drought-like conditions, and we'll be timing out that rainfall for you after this quick break.